Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic surgery. I do a lot of rhinoplasties or nose jobs, and I love doing them. I think they're very satisfying for both me and the patient. And a very common question that I get, because everybody reads on the internet, is that when people need grafts to their nose, whether it be a primary rhinoplasty where I want to increase tip projection, and a secondary rhinoplasty where I want to correct something that's been done before, or somebody that may just want some more prominence along their dorsum, whether it be somebody Asian or Latino, people are always wondering, is it safer to do a cartilage graft with your own cartilage or a synthetic graft, something like silicone? The answer to the question is that almost always we're best going with your own tissue. The reason being is that your cartilage is your own tissue. It's not a foreign body. It tends not to be rejected by your body, and there's much less chance for rejection or infection or anything like that. When we look at all the tissues combined, cartilage has the lowest rate of reabsorption. So the main risk when we put a cartilage graft in is really not reabsorption, but seeing that graft over time. So what we want to really do is when I put these cartilage grafts in, I want to minimize any surface irregularities and make it seem as though it's part of your body and you don't really see it as a cartilage graft. Commonly in some patients, a silicone graft is really the best alternative, and I'd say that when we can't do cartilage grafts, a silicone implant is a very nice procedure done especially in Asian and Latino patients that lack the prominence of the nasal dorsum, their profile, and lack tip projection. And these can be very long-lasting, permanent enhancements to somebody's nose to give them the kind of contour that they're looking for that makes them feel more attractive and makes them feel less self-conscious about what they feel, is a deficiency on their part. The main risk of having a silicone graft in, of course, is extrusion. That means it can work its way out, or infection. And whenever we see a graft work its way out like that, so we just need to take it out immediately so it doesn't get infected. But overall, I think cartilage is the best way to go if we're going to put a graft in your nose. Common places where I take the cartilage would be the nasal septum, the ear, and less commonly from the rib. But the best way to figure out what the best approach is if you're thinking about having your nose enhanced aesthetically is come in for a consultation. I image your photographs. We go over what I think is the best thing for you. You bring in photographs and show me the kind of noses you like, so we kind of meet in the middle and really have a common aesthetic projection or a common view of really what we'd like to have your nose look like in the future. Thank you.